strain graph. So as I told earlier also that there is a straight line, okay, and then there is a yield strength, and then it goes like this, and there is a fracture. Okay, so if we see this till the proportional limit is a straight line where the stress is directly proportional to strain. ओके यहाँ पे हमारा yield strength आ जाता है, और यहाँ है ना, if this is stress and strain, this will be under elastic, this is under plastic. Okay, so I am talking about the elastic region. Okay, so when we are talking about the elastic region, that means we are talking about the stiffness. The measure of stiffness or rigidity is your Young's modulus, or the modulus of elasticity. It is being described by the straight slope of the graph between the stress and the strain. तो हम कह सकते हैं stress, जब stress is directly proportional to strain, will gives you Young's modulus. Stress upon strain, okay, will gives you the value of Young's modulus. Okay, so if I say if some material resistance to abrasion or resistant to indentation is hardness, तो ये नहीं हो सकता. रेजिस्टेंट टू इलास्टिक फॉर्मेशन यही है. रेजिस्टेंस टू फ्रैक्चर हम कहेंगे फ्रैक्चर टफनेस, ठीक है. रेजिस्टेंस टू प्लास्टिक डिफॉर्मेशन. ओके, सो ओके, तो इसका मतलब हमारा जो मटेरियल है, अगर मान लो मैं बोलता हूँ कि किसी भी मटेरियल का मॉडुलस ऑफ इलास्टिसिटी हाई है, इफ आई से दैट द मटेरियल इज हैविंग अ हाई मॉडुलस ऑफ इलास्टिसिटी, that means it is stiffer, it is more stiffer. For example, enamel, cobalt, chromium. Okay, so these are very stiffer material. That means okay, even if you tend to provide load or you tend to give some bending forces, it will not bend, or it will have a very less elastic deformation, right? ठीक है. And if I say a material with a low modulus of elasticity, a material with a low modulus of elasticity, that means it will be more flexible, less stiff. For example, elastomers, any softer materials will have low modulus of elasticity. I hope it is clear. ठीक है, clear? Okay, next question. Which of the following chemical is added to PMMA as a retarder? Okay, let us see. Hydroquinone, benzoyl peroxide, metal oxide, and dibutyl phthalate. So here the correct answer is your hydroquinone. So let us see. When we are talking about the PMMA, it can be a cold cure or the self cure, or it can be heat cure. Okay, so when we are talking about, for example, the heat cure resin, we have the powder and we have the liquid. So when we talk about the powder contains the pre-polymerized PMMA beads. Okay, it contains an initiator in form of benzoyl peroxide. So benzoyl peroxide is mainly act as an initiator in heat cure. Okay, and oxides, metal oxides, maybe, you know, because it may be as a pigments or as an opacifiers. Dibutyl phthalate, normally dibutyl phthalate, you know, is mainly dibutyl phthalate is a plasticizer in resins. Okay, plasticizers in resin. Okay, okay, so the best answer here is hydroquinone. Right? So plasticizer, remember this, here we put in small amounts, छोटे amount में डालते हैं, right? So we need, so the cold cure and the heat cure, they mainly differ what is the type of initiator and the activator used to start the polymerization. Okay, so I have told you about the heat cure. The initiator is benzoyl peroxide, Okay, the activator is heat. The cross-linking, it also contains the cross-linking agent. Okay, it contains, the powder contains, also contain the cross-linking agent in form of ethylene glycol, dimethacrylate is the cross-linking agent in the powder. Liquid contains mainly two things. One is your MMA, monomethacrylate, and second is your inhibitor. We need inhibitor in form of hydroquinone. Why? Because otherwise and we also keep the liquid monomer in amber colored or dark colored bottles away from the light. Otherwise the inhibitor is added hydroquinone acid so that it doesn't pre-polymerize. The liquid shouldn't pre-polymerize. Okay, got it? ठीक है. अब जैसे ठीक है, कोल्ड क्योर में मेनली हमारा जो एक्टिवेटर होगा, कोल्ड क्योर में जो एक्टिवेटर इज मेनली योर टर्शरी अमीन, इज योर मेनली टर्शरी अमीन्स. और सारी चीज़ें ऑलमोस्ट सेम रहती है, बट टर्शरी अमीन इज द मेन एक्टिवेटर. ओके, गॉट इट? तो वो बेसिकली रूम टेम्परेचर पॉलीमराइजेशन होती है. सो हियर द बेस्ट आंसर इज हाइड्रोक्विनोन. ओके, सेकेंड क्वेश्चन, थर्ड क्वेश्चन, द मोनोमर, द पॉलीमर टू मोनोमर रेशियो. बेटा देखो, जो हमारे जब हम मिक्स करते हैं पॉलीमर टू मोनोमर रेशियो, ठीक है, बाय वॉल्यूम, इट इज बेसिकली बाय वॉल्यूम, इट इज 3:1, 3:1 by volume and 2:1 by weight. So the best answer is 2:1 by weight and 3:1 by volume. Powder and liquid, powder to monomer is the best answer, right? तो अब देखो, why do we require this? We require this so that we can have a proper mixing between the powder and the liquid. We get a proper dosage, we get minimum shrinkage, okay, during polymerization, and we should have very very good properties of the, okay. If we change too much of, for example, if I say, if I am having too much of monomer, monomer की concentration बहुत ज़्यादा होगी तो क्या होगा? Definitely, because monomer is more, it will evaporate more, there will be lot of polymerization shrinkage, there will be lot of polymerization shrinkage if it is more. Okay, then if the residual monomer content is more, then definitely there will be irritation, there will be more of shrinkage, the strength will be lesser. Okay, but if we say that if the powder is more than liquid, अगर हम वो follow नहीं कर रहे तो definitely the mix will be too flaky mix, very dry mix. Okay, it won't, the adaptability to the mold will not be that much great. Okay ना? So बट अगर आपसे वेट या वॉल्यूम का देखा जाए तो इट इज ऑलवेज वॉल्यूम बाय वॉल्यूम यू शुड टेक इट. ओके, ठीक है ना? सो इफ दे शुड नॉट बी टू मच ऑफ मोनोमर, दे शुड नॉट बी टू मच ऑफ पॉलीमर. सो द बेस्ट थिंग इज योर 2:1 by weight and 3:1 by volume. Clear है? I hope, see, this is a very very simple question, straightforward question. There should not be any problem in such. I hope it is clear. I hope it is clear. Any doubts? I will just check the chat box. Any doubts? Any doubts? Clear है? Okay, I will move on to the next question. Fracture of ceramic teeth. Fracture of ceramic teeth. in a denture over the years is due to, is it due to increased vertical dimension, is it due to ridge resorption, is it due to labally placed maxillary teeth, or is it due to loss of bond between the denture base and the ceramic teeth? Now the thing is, there are two reasons mainly. Understand why, if the denture base is made up of acrylic, okay, if it is made up of acrylic, okay, okay, so the main reason of acrylic, we have an acrylic denture base, and then we have, for example, if this is a porcelain teeth and this is denture base acrylic, so we must understand that the bond between the porcelain teeth, and the denture base is mainly mechanical. The bond is mainly purely mechanical bond. And when we are talking about the denture base with the porcelain teeth, what ये एक और important question आता है, for better mechanical bond we produce diatoms on the base of the porcelain teeth so that the resin can go inside and can mechanically interlock, या उसको बोलते हैं diatoric holes. In case of acrylic to acrylic, definitely the bond is more chemical in nature, and the bond is very, very strong. So it might be because first of all the bond is not that great, and also because of the I should say that because of the the brittle nature of the porcelain, it doesn't undergo even bit of plastic deformation, it breaks. तो अगर increase vertical dimension over the years, अगर increase vertical dimension, देखो it might be one of the reason, but it may be because immediate है, immediate में हो सकता है because of increase, but over the years it won't happen. So first option is not there. ridge resorption पे दांत का फर्क नहीं पड़ेगा, denture base fracture हो सकता है. Labally placed maxillary teeth may or may not be the best reason, but the fourth reason, the loss of bond and the brittle nature of porcelain, is the best answer in this case. Best answer. Okay, so over the years we know that there might be repeated fatigue, repeated stress, water absorption. ठीक है, there might be thermal changes, a lot of thermal changes because of thermal changes. So because of all this, the bond between the teeth and the denture base might loosen, and there might be some micro movement and it can fracture. So it is basically a combination of all these things. The bond is weak over the years because of thermal contraction, because of thermal, the expansion, contraction, water absorption, and over these there are a lot of forces, so it might lead to the loss of bond and can lead to fracture. So the best answer here is your loss of bond between the denture base and the ceramic teeth, right? Next question, which of the following, okay, and other reasons because porcelain मैंने बोला कि बहुत ज़्यादा हाई हो, ठीक है, या हमारे प्री मैच्योर कॉन्टैक्ट्स हों बहुत ज़्यादा, ऑक्लूजल प्री मैच्योरिटीज़ हों, बट वो होगा तो इनिशियली होगा ना, बाद में क्यों होगा? तो ये हमारे इनिशियल फ्रैक्चर्स की वजह से हो सकता है. इनिशियल फ्रैक्चर कैन अकर बिकॉज ऑफ दिस, बट लेट फ्रैक्चर्स होंगे तो बिकॉज ऑफ द लॉस ऑफ द बॉन्ड. ठीक है, ब्रक्सिज्म, पैराफंक्शन, ठीक है ना. तो ऑक्लूजल स्ट्रेसेस अगर बहुत ज़्यादा हैं तो इट माइट हैपन बिकॉज ऑफ दिस. ठीक है. अब ऑल्सो एज आई टोल्ड दैट बिकॉज the denture base and the porcelain teeth. Now denture base is having its own contraction, thermal expansion. Porcelain teeth is having its own thermal contraction. So internal stresses might develop at the interface. Okay, so it might be because of this. Also, as I told, because of water absorption, because of the aging of acrylic, because of water absorption, there might be dimensional changes. Okay, and patient is eating because of all this. ये सारी चीज़ें over the years the bond might get loosened and it might be a problem. Okay, clear? Next question, which of the following doesn't corrode the metal surfaces in our oral cavity? Now we all know that the corrosion, see, first is there is a difference between tarnish and corrosion. Tarnish is a forerunner of corrosion. मतलब tarnish is the lack of luster, मतलब जो कि फिनिश, सरफेस फिनिश या लस्टर है वो लॉस हो जाता है तो tarnish कहते हैं. बट इफ देर इज अ actual deterioration of the metal surface, then it is corrosion. And the corrosion might occur because of the chlorides, oxides and sulfides in the oral cavity. तो क्लोराइड्स भी होते हैं, ऑक्साइड्स भी होते हैं, सल्फाइड्स भी होते हैं ओरल कैविटी में, कार्बाइड्स थोड़ी होते हैं. तो बेस्ट आंसर हियर इज योर कार्बाइड्स. कार्बाइड्स आर नॉट देयर इन द ओरल कैविटी, दे आर नॉट फाउंड इन द ओरल कैविटी. नाउ क्लोराइड्स, बिकॉज सोडियम क्लोराइड इट माइट कम फ्रॉम सलाइवा, तो दैट मीट बी द सोर्स. ऑक्साइड्स के तो सोर्स आ रही हैं हमारे. ठीक है. अब स्पेशली क्लोराइड्स विल कॉज पिटिंग कोरोजन. क्लोराइड्स विल मेनली कॉज पिटिंग कोरोजन. ठीक है. ऑक्साइड्स तो रहते ही हैं. सल्फाइड्स मे बी प्रोड्यूस्ड बाय द एनारोबिक बैक्टीरियाज, दैट इज इन दी सल्फर कंटेनिंग फूड्स जो होते हैं. ठीक है. तो बेसिकली हम जो कहते हैं जैसे जो हमारा सिल्वर सल्फाइड कैन टार्निश द अलॉयज, बट कार्बाइड आर वेरी स्टेबल कंपाउंड्स. मुंह के अंदर नॉर्मली हमारे होता नहीं है, दे आर केमिकली इनर्ट. ओके, योर कार्बाइड्स आर केमिकली इनर्ट, दे डोंट कंबाइन विद मेटल्स, so they do not cause any corrosion. So carbides are very stable compounds. So best answer here is your, so the best answer here is your carbides. तो हमारे ऑक्साइड्स भी होते हैं, क्लोराइड्स भी होते हैं, सल्फाइड्स भी होते हैं. कार्बाइड आर वेरी स्टेबल कंपाउंड्स, normally chemically inert, doesn't corrode the metal surface. Okay, and they do not have any reaction with the metal surface. Okay, so the best answer here is your carbides. Clear hai? Then what is the role of plasticizer in synthetic resins? So when we are talking about the plasticizer in synthetic resin, so the choices are increases the smoothness of the mix to form the bulk of material, reduce the softening and the fusion temperature, and to decrease the polymerization shrinkage. So the best answer here is reduce the softening and the fusion temperature of the resin. The best answer. अब हम समझेंगे प्लास्टिसाइजर. अब देखो प्लास्टिसाइजर बेसिकली हम रेजिन में डालते हैं so that we increase the, normally for any material, resin नहीं, to increase the flexibility, to increase the workability for any material for that matter. It is not because only the resins. Okay, तो basically होता क्या है कि दो जैसे पॉलीमर चेन्स होती हैं तो उनके बीच में बेसिकली हमारा प्लास्टिसाइजर आ जाता है, तो जिसकी वजह से हमारी फ्लेक्सिबिलिटी और वर्केबिलिटी इंप्रूव होती है. ओके, तो बेसिकली इंक्रीज फ्लो, वर्केबिलिटी, ये सारी चीज़ें हमारी आसान हो जाती हैं। दूसरा, इट रिड्यूसेस द ब्रिटलनेस, इट रिड्यूसेस द सॉफ्टनिंग पॉइंट एंड द फ्यूजन टेम्परेचर ऑफ द रेजिन, वेरी इंपॉर्टेंट। ठीक है, तो इसका मतलब ये है कि हमारा जो रेजिन है, इट रिड्यूसेस द ग्लास ट्रांजिशन टेम्परेचर एंड द सॉफ्टनिंग टेम्परेचर सो दैट आर रेजिन्स might be soft or resilient, more softer at room temperatures. तो it reduces the, mainly तो यहाँ पे आंसर होगा it reduces the glass transition temperature, the fusion temperature। ठीक है, हमारा पॉलीमराइजेशन श्रिंकेज को कम करने में प्लास्टिसाइजर का कोई भी रोल नहीं है। ठीक है, it enhances, it increases the impact strength of the resin, okay, controls the porosity, ठीक है, it controls the porosity या reduces the porosity। why? because कितना मोनोमर हमारा पॉलीमर में जाएगा, it is also controlled by a plasticizer। जितने मतलब प्लास्टिसाइजर हमारे कम मात्रा में होते हैं, बट दे आर वेरी वेरी इंपॉर्टेंट। ठीक है, नॉर्मली जो हमारे प्लास्टिसाइजर जो यूज़ होते हैं हमारे रेजिन में, नॉर्मल प्लास्टिसाइजर जो यूज़ होते हैं हमारे रेजिन में, वो हमारे होते हैं डाइब्यूटाइल थैलेट, या ब्यूटाइल थैलेट। डाइब्यूटाइल थैलेट या ब्यूटाइल थैलेट, these are common plasticizers in acrylic resin and they are used in tissue conditioners mainly, acrylic based tissue conditioners, temporary soft liners and some cold cure resins। tissue conditioner, temporary soft liners and some cold cure resins। ठीक है, बट द प्रॉब्लम इज दैट द प्लास्टिसाइजर इन द रेजिन, देखो हमारे जब भी प्लास्टिसाइजर होते हैं, देखो हमारे टिश्यू कंडीशन को चेंज करने की ज़रूरत कब पड़ती है? हफ्ते एक बाद, आफ्टर 1 वीक। वाई? बिकॉज दीज प्लास्टिसाइजर्स दे मे लीच आउट एंड कैन हार्डन द रेजिन, ओके, बिकॉज ऑफ द एंड मे ऑल्सो okay, and also because they may leach over time। just a minute, I'll just add the charger to my, just plug in the charger, just give me a second। so sorry, okay, so it reduces the softening and the fusion temperature, but we should not use it in too much of amounts। why? because it may leach over time and can harden the material, okay, and remember this, that if we increase too much of plasticizer, it may actually reduce the strength of the polymerized resin। so plasticizer should be added in very small amounts, very very important question, clear hai? So plasticizer should not be added okay, clear? So best answer here is reduce the softening and the fusion temperature, okay। which of the following material sets by condensation reaction. Okay, अब see, अब alginate again, alginate sets by a chemical change. We all know that alginate, sodium alginate reacts with, for example, calcium sulfate. Okay, it is not a direct reaction. सबसे पहले कैल्शियम सल्फेट हमारा किससे रिएक्ट कर जाता है? सोडियम फॉस्फेट से, so that it gives time, because it's a very very fast reaction. The reaction between sodium alginate and calcium sulfate is a very very fast reaction. So this acts as a retarder, and first it consumes the sodium phosphate first, and then it comes the reaction, and then we get a sodium alginate. So it's a chemical reaction. Agar and agar sets by physical change. We know it is based upon the sol gel mechanism. Based upon sol gel mechanism. Okay, we have 3 chamber liquefaction chamber, the tempering chamber. Okay, zinc oxide eugenol impression paste, again it sets by zinc hydroxide plus water. It's a autocatalytic reaction. Again it's a chemical reaction. It's a chemical reaction, autocatalytic reaction. Okay, polyether, because it is a elastomer, it is a polymerization reaction. So the answer here is your polyether. Polyether. Now okay, now it's a polymerization reaction, but the catch here is it a condensation polymerization? So polyether का जो reaction होता है, now we all know that polyether जो impression material है हमारा, just a minute, I'm just seeing any questions are there. People are not asking any questions. So we all know that it is containing a base paste and it is containing a catalyst. So in base paste we have polyether prepolymer, okay, with reactive. We know that it has, the polyether premolar has a reactive aziridine rings, and the catalyst is having mainly the sulfonic esters, the aromatic sulfonic esters, aromatic sulfonic esters. So it is the reaction between the polyether prepolymer and the aromatic sulfonate ester. So it forms a cross linking reaction and forms a polyether. Okay, and normally doesn't have any that much of byproducts. Okay, so normally it's a 3-dimensional network. Okay, थोड़ा सा बस इसमें वाटर, यस वाटर इज अ बाई प्रोडक्ट थोड़ा सा है, ठीक है. तो ओवरऑल इट्स अ कंडेंसेशन पॉलीमराइजेशन रिएक्शन. इट्स अ टाइप ऑफ कंडेंसेशन पॉलीमराइजेशन रिएक्शन. वाई बिकॉज हम ये कहते हैं कि it sets by, write down, it sets by a cationic ring opening. जो aziridine ring है, just a minute, okay, so it's a type of cationic ring opening. Because of the aziridine ring it opens. It's a type of a condensation polymerization reaction. So here answer is polyether. Okay, next question. Luting of all ceramic laminates is done with the help of light cure, resin cement, compomer, zinc oxide eugenol, and any material of choice. We all know, remember this, that normally जो हमारे लैमिनेट्स होते हैं नॉर्मली दे आर मेड अप ऑफ ग्लास सेरामिक्स. हम उसे कहते हैं योर IPS, या इट इज दीज आर प्रेसेबल सेरामिक्स, नो? तो IPS Empress 1 and 2. Okay, so glass ceramics, they, if we have a crown, then we have a veneer made up of glass ceramic. So when we are talking with respect to crown, because crown will be more thicker, more than around 1.5 to 2 mm. So if the color of the cement, underlying cement changes, it won't change the color of the crown. So we can lute a all ceramic crown with the help of a dual cure resin cement. Remember this, that when, if we talk about the classification of the resin cement, we have self cure resin cement or self adhesive resin cement, then we have dual cure resin cement, and then we have visible light cure resin cement. These are the three cements that are used in dentistry. Self adhesives will have tertiary amines. Dual cure have both chemical and light agents, for example camphoroquinone. And the visible light cure, it is completely light cured. It doesn't have any chemical tertiary amine. Now the problem is that, as I told, that if it's a crown, I can use a dual cure resin cement or even a light cure, but mainly dual cure is fine, because the light might not percolate through the thickness of the crown. But when the veneers, when we're talking about veneer where the thickness is only 0.3 to 0.5 mm, so, and the light will percolate through the thickness of the veneer, best is visible light cure resin cement, because visible light cure resin cement doesn't have a tertiary amine or an activator. So the problem is that after some time, if we have used a dual cure or a self adhesive cement, even in case of veneers, after some time there is oxidation of the tertiary amines, which leads to discoloration. And because our veneers are very thin, this discoloration will be visible, and the color of the veneer changes. So do you want that to happen? No, I do not want that to happen. So that is why when I am luting a veneer, I use a visible light cure resin cement. Very, very important question. Now if I am talking about this, I should also talk about the procedure. So there are two preparation. One is preparation of the veneer, and the preparation of the tooth that we have already prepared, and we have already made the impression. So on the veneer, the tissue surface, we treat it with the hydrofluoric acid. It might be 4%, it might be 9%, 4 to 5%. हम 20 सेकेंड्स के लिए उसको रख सकते हैं. अगर 9 to 10% है तो 10 सेकेंड्स के लिए we will just polish it. We will just place it on the tissue surface, wait for this, and then we will wash it and dry it. It will have a very, very chalky appearance. Then what we can do, then we apply a slain coupling agent. Then we apply a slain coupling agent on the tissue surface of the veneer. Talking about the tooth, as we do it for composites, we will treat it with phosphoric acid, 37% phosphoric acid, H3PO4, for example, for 20 to 30 seconds. Wash and dry, and then we apply a bonding agent, but please do not cure it, because if you cure it and it gets pooled, your veneer will not be coming exactly on the tooth surface. It might have a fitting issues. So then we apply the resin cement on the veneer, and then we can lute it give a light initially for 3 to 5 seconds, remove the excess flash and then cure it completely. Okay, and last, the curing should be done on the margin. The curing should be done with the Vaseline applied, and then curing should be done through the Vaseline. Why? Because I do not want any oxygen inhibition layer present on the margin. If I am curing through thin air and not using Vaseline, a layer of Vaseline, then okay, so I hope it is clear, right? Next question, glazed porcelain true is, okay, glazed porcelain is stronger than unglazed porcelain, yes, okay, weaker, it has no effect on the strength of porcelain, less aesthetic than unglazed porcelain. Now देखो कोई भी चीज़ स्पेशली सिरामिक या पोर्सलेन इज ऑलवेज वीकर under tension and shear. It might break, but ceramic is always stronger under compression. Ceramic is always stronger under compression, remember this. Now once we have, for example this is PFM or XYZ, we have done the buildup of ceramic on the metal, okay, then we do the mixed trial. In the patient's mouth we check the occlusion, we trim it, we do the occlusal adjustments. Now because of all this, there might be some surface irregularities and surface cracks, and we all know that if there are surface cracks, there might be propagation of the cracks, and the ceramic might fracture under tension forces. Do you want that to happen? No. So because of this, either I glaze my porcelain or I polish it. So here the question is about glazing. So glazing, if I compare between the glazed porcelain and the unglazed porcelain, definitely the glazed porcelain, because it will fill all the irregularities and the cracks, it has to be stronger than unglazed ones. It cannot be weaker than the unglazed porcelain. It has definite effect on the strength, and definitely what are the with glazing, definitely it will be more aesthetic. It is, fourth option is not there, it has definite effect on the porcelain, it is stronger. Definitely the first answer is A. The first answer is your A. Okay, now when we talk about the glazing, तो glazing के advantage क्या है? It will become more aesthetic for sure, more stronger, yes, then food debris, less food debris collection, then reduced wear of the opposing teeth. एस्थेटिक भी है, सारी चीज़ें हैं, ठीक है, एंड इट हैज़ अ रिड्यूस्ड वियर ऑफ द अपोजिंग टीथ. नाउ वी शुड ऑल्सो टॉक अबाउट व्हाट आर द टाइप्स ऑफ ग्लेजिंग. तो व्हेन वी आर टॉकिंग अबाउट द टाइप्स ऑफ ग्लेजिंग, वी हैव अ सेल्फ ग्लेज और an auto glaze, then we have a add-on glaze. Now what is the self glaze and add-on glaze? Remember, the self glaze is more permanent than add-on glaze. Self glaze और auto glaze, what we do is, आपने जो भी साइकिल देनी थी, फायरिंग साइकिल आपने जो देनी है सब कुछ ऐड करके कर दिया, then we give a glazing cycle. Whenever we are glazing, देखो, whenever we are building up the porcelain, we want building of the porcelain, not glazing, remember this. When I am talking about the build up of the porcelain, I want the condensation to occur, I want the particles to come closer, I want the excess of water to go out, so that there are less or no porosities in my porcelain, and it becomes much more denser, much more stronger. So during buildup of the porcelain layers, for example dentine body, the enamel, so we have to put the vacuum on. We want the particle to come closer. So during normal cycles the vacuum of this furnace is kept on. But once we are doing glazing, because everything has been done, I just give a glazing cycle. And self glaze or auto glaze is that, for example if 100, for example if the 100 degree Celsius is the melting point of porcelain, तो हम क्या करते हैं, हम इसको 85 to 90 नियर दी मेल्टिंग पॉइंट लेके जाते हैं. सो होता क्या है, जो आउटर मोस्ट लेयर है वो मेल्ट हो जाता है. टोटल लेयर का जो आउटर मोस्ट लेयर है हम फर्नेस में जब डालते हैं तो हम उसके मेल्टिंग पॉइंट तक नहीं, बट वेरी क्लोज टू द मेल्टिंग पॉइंट, तो इट डजंट मेल्ट. सो तो ग्लास होता है तो द आउटर सरफेस मेल्ट्स एंड गिव्स इट अ ब्यूटिफुल ग्लेज्ड अपीयरेंस. इट इज़ मोर परमानेंट. एड ऑन ग्लेज में वी यूज स्पेशल पाउडर लिक्विड्स add on to the surface and then we give a glazing cycle. Got it? So it is more stronger than your unglazed porcelain. It is more stronger than the unglazed porcelain. Next question. Patient has undergone radiotherapy for carcinoma in head and neck region 2 years back and his mucosa looks friable. This is the catch. What is the material of choice for impression making in such scenario? Can you use ZOE? Can you use reversible hydrocolloid? Can you use alginate or polysulfide? देखो इसमें catch है. Always remember, whenever you have friable mucosas, okay, I do not want any too much of pressure. So best is your light bodied elastomers are the best choice for such cases. Light bodied elastomers. अब यहाँ elastomers में देखो पॉलीसल्फाइड तो यूज़ नहीं होता, बट अगर मैं चॉइस देखूँ ZOE, रिवर्सिबल, एल्जिनेट, पॉलीसल्फाइड, तो अगर यहाँ पे सिर्फ रबर बेस होता तो रबर बेस, लाइट बॉडी रबर बेस इंप्रेशन मेटल वुड हैव बीन द आंसर. बट पॉलीसल्फाइड इज ऑल्सो गिवन, तो ठीक है, इनसे तो बहुत बेहतर ही है पॉलीसल्फाइड. तो द पॉलीसल्फाइड हेयर द बेस्ट आंसर इज योर पॉलीसल्फाइड्स. ओके, द आंसर इज पॉलीसल्फाइड. और यहाँ हम बोल सकते हैं लाइट बॉडीड इलास्टोमर्स. अगर ये दे रखा हो तो ये आंसर. आई डू नॉट वांट एनी प्रेशर. आई डू नॉट वांट माय मटेरियल टू स्टिक ऑन इट. आई डू नॉट वांट माय मटेरियल टू गेट डिस्प्लेस्ड बिकॉज इट इज हाईली फ्राइबल. गॉट इट? सो द बेस्ट आंसर इज पॉलीसल्फाइड्स यहाँ पे इस साइड. ठीक है. नेक्स्ट क्वेश्चन. When these soft liners are used, okay, अगर मान लो ये मेरा रिज है, अब समझना मेरी बात, हम सॉफ्ट लाइनर क्यों लगाते हैं? ये मान लो डेंचर है, दिस इज द डेंचर एंड वी हैव प्लेस्ड अ लेयर ऑफ सॉफ्ट लाइनर ऑन द टिश्यू सरफेस ऑफ द डेंचर. ओके, द प्रेशर थ्रेशोल्ड ऑफ द अंडरलाइंग रिज, definitely because it is having a shock absorbing effect. So the pressure threshold on the ridge, definitely it increases. उसका threshold pressure लेने का increase हो जाएगा. Why? Because the excess pressure will be absorbed by the soft liner. It will be acting as a shock absorber. Soft liners, they constantly flow. They constantly flow at room temperature. The polymer chains के बीच में जो प्लास्टिकाइजर होते हैं वो फ्लो कर जाते हैं and it produces a shock absorbing effect. तो when it produces a shock absorbing effect, तो अगर ज़्यादा फोर्स पड़ती भी है तो थ्रेशोल्ड हमारा सहने का रिज का बढ़ गया ना, तो इट इज़ बेटर. सो द आंसर हियर इज इट इंक्रीजेज. ओके, इट इंक्रीजेज. ठीक है. देखो ये भी पार्शियली करेक्ट, डिपेंड ऑन द रेजिलियंसी ऑफ द वेजल टिश्यूज, बट ओके, पार्शियली करेक्ट, बट द बेस्ट आंसर इज द थ्रेशोल्ड ऑफ द रिज increases, for the pain the threshold increases when I reline the denture with a soft liner or a tissue conditioner, right? Even the whenever we are using tissue conditioners, we are using it as treatment dentures. Remember, write down tissue conditioners, treatment dentures, because we are treating the abused tissues in that. Clear hai? Clear hai? So it is absolutely clear that the pressure threshold of the underlying ridge with the soft liners, definitely it increases. Threshold increases. Okay. The type of strain developed when the force is applied perpendicular to the surface. Okay, let us see. Tensile is when the force is applied in equal and opposite direction. The force is applied in equal and opposite direction and then tends to elongate or lengthen the body. So that means it is under tensile or tension. तो ये तो टेंसाइल नहीं हो सकती, परपेंडिकुलर तो नहीं लग रही है, तो लाइन लग रही है, पैरेलल लग रही है. टॉर्शनल फोर्स और shear is your sliding forces. टेंसाइल स्ट्रेन और टेंशन तो चली गई. टॉर्शनल इज योर स्लाइडिंग फोर्सेस, वो भी नहीं है, shear भी नहीं है. कंप्रेसिव, यस. इफ देर इज अ बॉडी and if the forces are perpendicular to the body, so that tends to shorten it or compress it. तो यहाँ पे the best answer is your compressive strain. The developed strain is your compressive strain. Compressive strain. Clear? Any doubts? Any doubts? Okay, there are some another kuch important question, because the INICET, because we still have 5-10 minutes, so I'll just add one or more questions or test your knowledge. We talk about the manual shade guides. For example, we talk about the Vita Classic and we talk about the Vita 3D Master. INICET will have one question on shade guides, remember this. So Vita Classic, the rule is we take first hue, then chroma and then value, remember this. In 3D Master, we take first value, then chroma and last hue. Remember this. Okay, we first take value, then chroma and then the hue. So you should know the order. You should know the order. Okay. Then we should know the strengthening of the ceramics. When we are talking about the strengthening of the ceramics, we know that we have to first reduce the by inducing the compressive stresses to reduce the crack propagation. Okay, so this we do it either by then we have I'll tell you, then we have your dispersion strengthening, and then we have your transformation toughening. Transformation toughening is basically we see in yttrium stabilized zirconia. Yttrium stabilized zirconia. Dispersion strengthening का मतलब है हम कोई भी ceramic में we have a glass matrix and if we are adding any filler that tend to reduce the increase the force and tend to reduce the increase the strength of the ceramic and strengthen it. So dispersion strengthening it, we are adding some filler. For example, we are adding lucite in IPS Empress 1 and lithium disilicate. ये बहुत important question है. IPS Empress 1 में होता है ल्यूसाइट reinforce होते हैं. 2 में IPS Empress 2 में it is lithium disilicate. ठीक है, crowns. Remember this, lithium disilicate crowns are the most, write down, it is the most aesthetic. One question came in previous years NEET that one of your friends need the crown in the most anterior teeth. So the crown in most anterior teeth, the choice of material is your lithium disilicate because it is highly aesthetic. But the problem that is that it takes the color of the surroundings, adjacent teeth and also the underlying cement. तो इसीलिए हम जब भी इसको ल्यूट करते हैं, so we should be using trial cements and check the color because after luting also the color of the luting agent might alter the color of the veneer or the crown. So you have to be careful when you are doing it. So first is inducing the compressive stresses to reduce the crack propagation. Either we can do some ion tempering, your ion exchange, where the big potassium ions, there are small sodium ions in the ceramic. तो हम क्या करते हैं, उसमें से कुछ छोटे छोटे सोडियम आयंस को निकाल के मोटे मोटे पोटेशियम आयंस डाल देते हैं, तो जिसके कारण कंप्रेशन लोड आ जाता है, कंप्रेसिव फोर्सेस डेवलप हो जाती हैं एंड इट टेंड्स टू reduce the crack propagation. Second is that we can be more we can see the compatibility or very less difference or no difference in the, for example, we are talking about PFM, so the thermal compatibility between these two. So the thermal compatibility between these two is basically we should have almost matching coefficient of thermal expansion between the metal and the ceramic. Okay, then because of thermal tempering, then there is thermal tempering. Thermal tempering का मतलब है जब भी हम हाई हीट से नीचे जाते हैं PFM और जब हम करते हैं तो जो मेटल है वो हमारा पहले ठंडा हो जाता है, तो इट टेंड्स टू कॉन्ट्रैक्ट द आउटर मोस्ट लेयर ऑफ द सेरामिक हल्का सा, तो इट प्रोड्यूसेस दोज कंप्रेसिव लोड्स. So we induce some compressive stresses to reduce the crack propagation. Again, transformation toughening also does that. Dispersion strengthening also does it. Also, we, there is one more question that the best occlusion to reduce the ceramic fracture in the posterior teeth is to give a canine guided occlusion, because in canine guided occlusion there is posterior disocclusion. So if you don't have multiple contacts on the posterior ceramic teeth, it won't fracture. But if you give, for example, if you give a lot of contacts, for example, a group function or a balanced occlusion in natural teeth, it will fracture, it will wear out. Clear hai? I hope everything is clear. I still am not seeing any doubts. Okay, I hope the session was helpful for you people and you have learned a lot. These were the important questions that came in November INICET. Okay, I hope it was a huge help for you. Kindly follow these questions, the explanations, whatever I have given. Okay, and if any doubts, kindly put in the comment section. I will definitely solve it. So wish you all the best. Okay, पढ़ते रहिए अच्छे से. Any questions, kindly ask. Clear है? Thank you so much. Good night. Take care.